how does depression increase the risk for dementia? There are some behavioral components to it. When people are depressed, they may be more physically inactive. That physical inactivity, because maybe lack of motivation associated with depression or lack of interest in doing things that could be associated with depression, that lack of activity can increase the risk for dementia. And that's because what's good for our heart is good for our brain. And so, if we're not taking care of our body, including our heart, that can impact our brain functioning and increase vulnerability to conditions like dementia disorders. Another is that when we're experiencing depression, we might be more socially isolated and withdrawn. And social isolation and loneliness also increase the risk for dementia. When people have a diagnosis of depression, they may also be more likely to not take medication as prescribed by their doctor, because sometimes there's a feeling of what's the point if we're not seeing much joy or purpose in living. Why would we take medications? So with depression, there can be an increase in medical non-adherence. And on that Lancet 2024 Commission list of modifiable risk factors for dementia disorders, there are several physical health conditions like diabetes and hypertension, high cholesterol, that also increase the risk for dementia. Biologically, depression also impacts brain function and our physiology, from chronic inflammation in our body to HPA axis dysregulation to even neurodegeneration. And so there are many different pathways that depression increases the risk for dementia disorders. But the good news is we can change this trajectory. And this is because depression is highly treatable among middle-aged and older adults. I'm Dr. Regina Koepp, and this is your weekly mental health and aging tip.